Hello, everyone, and welcome. Today's presentation is for those who are new to person-centered services. The presentation is not intended to go in depth on any particular topics, but rather to give you a brief overview of care coordination and other services offered under New York State's Office for People with Developmental Disabilities, also known as OPWDD. This presentation will familiarize you with some topics and terms and will help better prepare you for your care coordination experience. At Person Centered Services, we begin all our presentations with our mission, vision, and values. Our mission: connect people to the care, support, and opportunities that maximize their quality of life. Vision: a community where all people lead fulfilling lives. And our core values: people, integrity, and trust. My name is Craig Menig, and I am the Member Relations Manager. Member Relations has the goal of improving our members' experiences with care coordination. Our orientation is meant to be a brief overview of what you can expect from your care coordination experience. We are going to touch on many topics to help you gain some familiarity, but we understand that there's a great deal of information coming at you quickly. In order to support your understanding and recollection of what will be discussed, you have been provided a handbook, so you have it as a reference when these topics come up again. The intent of the handbook is to give you a bit more information on each of the topics we'll review today. We've also provided space within the handbook for you to take notes. Your handbook has a space for the name and contact information for your care coordinator and your care coordinator supervisor. There is other important contact information in the handbook as well. Person-Centered Services, a brief overview. Person-Centered Services provides care coordination to nearly 18,000 people in 21 counties. We have around 800 employees and work with over 50 organizations that provide services overseen by OPWDD. We also work with many community-based organizations, and we are forming more relationships continually. Along with oversight by OPWDD, we are also responsible to the New York State Department of Health, the Office for Medicaid Inspector General, also called OMIG, and the Federal Centers for Medicare and Medicaid Services, or CMS. What can I expect? You've gotten through the eligibility and intake process and are now enrolled with Person-Centered Services. What can you expect next? You will be contacted by a care coordinator. While this care coordinator may be assigned to begin working with you, it is important that you understand that if you don't feel like this care coordinator is a good match for you, you can ask for someone else. Contact information for your care coordinator supervisor will be provided to you, but you should always check with your care coordinator to make sure they know how you're feeling and they have a chance to improve the situation. We often find that a situation can be improved through a good discussion. What are my care coordination options? Your care coordinator will make sure you're receiving the type of care coordination you need. Health home care management and basic HCBS services are two service options. If you choose basic service, your care coordinator will help you to arrange OPWDD services and supports and will ensure your level of care eligibility determination, or LCD, is completed annually. The LCD, which you may already be familiar with, is an assessment that is completed with you to make sure you qualify for OPWDD services. In basic, your care coordinator will also make sure your life plan is reviewed and updated twice per year. Having this service will allow you to participate in the services under the HCBS waiver, which are OPWDD services that we'll discuss later. This is a low level of care coordination involvement. Health home care coordination coordinates OPWDD services along with coordinating access to mental and physical health and dental services. This service also helps to identify community-based services, ensures all services are connected, and helps you navigate various service systems. The care coordinator providing this service will also complete your LCED redetermination. While you are currently enrolled in one of these care coordination options, you can change from one to the other as your needs change. Your workbook has further explanation of the LCED and also describes the differences between the two care coordination options in more detail. Assessments. We need to work with you to complete several assessments. Assessments are done to ensure that your level of need is determined, and this will identify your need for services. One of the first assessments is called the Developmental Disabilities Profile 2, or DDP2. The DDP2 will help us get a sense of the amount of support you need. The DDP2 addresses all aspects of your life and the needs you have in each area. It is important that you work with your care coordinator to answer questions as accurately as possible, as the results will drive your access to services. The DDP2 also helps to determine a tier that you will be assigned, and that will be discussed later. Another assessment we complete with you is called a PATHS assessment. This assessment is a little more in depth and takes a bit longer to complete. The PATHS assessment is used to learn more about you through a more thorough discussion. It takes a rather long time, but is important because it helps us discover information that we may not get through more casual discussions. It is also important because the information is used to create your life plan. The PATHS can be fun and interesting because it allows you to talk about your life and the areas of your life where you would like and need help. Another assessment that will be completed with you is called the Coordinated Assessment System, or CAS. This is not completed with you by your care coordinator, but by a third-party assessor. Your care coordinator will help to arrange this assessment. The CAS takes a bit longer to complete and is more thorough than the DDP2. It will result in a deeper understanding of your service needs. The CANS assessment is similar to the CAS, but it is specific to children under 17 years old. This will include an interview by the assessor with the parent caregiver. Please see your handbook for more information on these assessments. Tier levels. There are 4 tier levels, 1 through 4. The DDP2 will result in a determination of your tier and your care coordination support needs. This is determined through identifying the amount of support you already have in your life compared to challenging situations you face, including mental and physical health-related issues. Tier 1 indicates the lowest level of support need from your care coordinator, and Tier 4 is the highest. If you are determined to be in Tier 4, your care coordinator will need to have more contact with you, and your care coordinator will also have a smaller caseload in order to better meet your needs. Your handbook has more information on the tier levels. Interdisciplinary Team, or IDT. The care coordinator is responsible for helping you identify your interdisciplinary team. The IDT should be made up of people that are important to you personally and people who represent your service providers. Your IDT may also include people that specialize in meeting your health needs. You are the lead of this team, and the purpose of this team is to engage with you in a person-centered life planning process. Your care coordinator is responsible for gathering and communicating important information with you and the rest of your IDT. The person-centered planning process and your life plan. Your care coordinator helps you to lead your life planning process and develop your life plan. Your life plan is very important because it helps to inform people about what is going on with your life and your planning so that you are receiving consistent support across service providers. It is also important that the planning is well documented. This is done by your care coordinator in your life plan. Your life plan should be a good description of you and should include your dreams, desires, goals, fears, relationships, some important history, and your current situation. Person-centered planning is an ongoing process to ensure that you're receiving the supports and services you need as you grow and change. A well-developed and well-written life plan will improve your experiences with services by helping to ensure that those working with you have a good understanding of your dreams, goals, preferences, challenges, and communication styles. Your handbook has more information on person-centered planning and your life plan. Services and supports. Through the life planning process, you may identify services that will help you reach your goals. The OPWDD service system offers supports that assist people with intellectual and developmental disabilities in all aspects of their lives. These services and support areas include mental and physical health, behavioral, residential, social, vocational, parent and family supports, technology and environmental modifications. The person-centered planning process will help to identify the services and supports that you would benefit from and that will support positive health outcomes. Your workbook has a good explanation of OPWDD services and supports. Your care coordinator will also help you to identify community-based supports to help meet your service needs. These include almost any services available in your area, but will minimally include medical and dental services. It is important to understand that getting services rarely happens quickly. There are a number of factors that contribute to this, but one of the main factors is that there are just not a lot of service providers for everyone who wants services. Your care coordinator will try to keep you updated, but be sure to ask if you have questions on the status of services for which you've applied. You can also ask about what is causing delays in your services, and the care coordinator will do their best to let you know. The electronic medical record, or EMR. We use an electronic medical record system to store information that we create or receive about you, including notes about everything we do for you. This is where your life plan is stored and where we document the activities we conduct on your behalf. This system is very secure, so your information is safe. At some point, you will be able to access your information through a portal. Through the portal, you will also be able to communicate with your care coordinator and sign documents, and that could support good communication and be a more efficient way to get tasks done. Our EMR is called CX360 and was made by a company called Core. You may hear the terms CX360 or Core used by your care coordinator. My responsibilities. What is my role in all of this? Your biggest responsibilities are to be responsive and to communicate with your care coordinator. The care coordinator needs many things from you to help you get what you want and need. If your care coordinator needs to hear from you or needs something from you, your responsibility is to get back to them. Moving forward and getting you what you want or need is dependent on you doing your part, including reviewing and signing paperwork necessary to secure services and supports. If you are receiving health home care coordination, you should hear from your care coordinator at least once per month. If you do not, you should contact your care coordinator's supervisor to let them know. Be sure to keep your care coordinator updated with any changes to your address, email, or phone number. It is also important that you understand your life plan and your services. If you are having trouble understanding, make sure you speak with your care coordinator. You may have noticed that we use a lot of acronyms like LCED, PATHS, CAS, CANS, IRA, and many, many more. If you don't know what something means or what an acronym stands for, ask. We know we use a lot of jargon, and that can be confusing. Another big responsibility is for you to make sure you know who to contact when you need to discuss your services. We want to be sure people are as satisfied as they can be. This means you have the responsibility of knowing who you can contact and making contact when things don't seem to be going the way you want. Contact information will be provided to you, but be sure to keep it in a place that you can find it when it is needed. As stated earlier, always check with your care coordinator first. Do not assume that they know when you have questions or concerns. Being a good communicator and maintaining a good relationship with your care coordinator will improve your experience with care coordination and your overall experience with services. Making contact. There may be times when you feel like you are not getting what you need, you don't understand what is being done on your behalf, or when you feel like you want to tell your care coordinator's supervisor how happy you are. At the beginning of your workbook, there are names and contacts for you. The care coordinator needs to know when you have questions or concerns, so start with them. Your care coordinator should be given the opportunity to know what you want or expect and be given the opportunity to be sure you're getting the communication you want in the way you want it. It is very important that they give you the clarity and transparency that you need so you know what is going on with your services. When you contact your care coordinator for something that is not urgent, meaning that you do not have an immediate need, please be sure to always leave a message and give them 48 hours to get back to you. It is important that you understand that a big part of what care coordinators do is to prioritize their activities with the people on their caseloads. This may mean that someone else they support needs their attention, so sometimes it is important that you are patient when contacting your care coordinator. If you contact a supervisor, local director, or anyone else, they will ask if you first contacted your care coordinator and have given them 48 hours to get back to you. Some other people you can contact are regional directors, customer service, or member relations. Team members from many of these areas will help connect you to someone that will help you to resolve issues that you're having, but all will ask if you've given your care coordinator time to get back to you. There are a few places where you can get contact information. Your life plan has your care coordinator and their supervisor. Your handbook has contacts and links. Our website, personcenteredservices.com, has contact information based on where you live. Our website also has contacts for our customer service and member relations team members. If you are having an emergency, meaning that your health and or safety are in immediate danger, you should call 911. We have on-call supervisors available after hours between 4:30 p.m. and 8 a.m. on weekends and holidays. You should contact our on-call number when you have an urgent need for care coordination services outside our normal hours. Groups that can support me, sharing experiences, learning, and helping. Self-advocacy groups and parent groups can offer support from people who have gone through or are going through similar challenges as you. Both offer opportunities for making connections with others and sharing ideas, experiences, and opportunities. Self-advocacy groups often discuss and address approaches to concerns faced by people with intellectual and developmental disabilities on a larger scale, or can be valuable in supporting people with individual issues. Parent groups can be good supports to parents who are new to the OPWDD system or experiencing something new. Parents can share resources and provide or seek advice. Both groups can have a strong impact on the OPWDD service system by advocating alongside care coordination and provider organizations when gaps in the OPWDD system are identified. Your care coordinator and service providers can help you research support groups in your area. You can also check the websites of provider organizations in your area to learn about groups and events. The Person Centered Services website has many resources as well. The teams that support your care coordinator. Because Person Centered Services works with so many people, we have several teams that provide support to our care coordinators. This is a list of the functions within our organizations that are here to support our care coordinators. These teams each have specific roles. The teams are community relations, provider relations, member relations, quality and program supports, clinical and resource team, learning and development, quality assurance and corporate compliance, intake and enrollment, information technology and security, policy and regulatory affairs, human resources, marketing and communications, finance, and administrative supports. Additional resources. We have provided links to 3 major resources that will be valuable to you. We strongly encourage you to explore these websites to become familiar with the information they have. Lastly, each provider organization has their own website. These websites contain information on the services that provider organizations offer, contact information, and other resources. Staying informed will improve your experiences with care coordination and other OPWDD services. Here is a barcode to link to the Person Centered Services website. This is a link to the Knowledge Center. And here's a link to the OPWDD website. I would like to thank you for joining this presentation. If you have questions or need clarification on this presentation, you can contact us at memberrelations@personcenteredservices.com. Our team will be sure to get the answers to your questions or put you in touch with someone that can. Again, thank you for joining today, and I wish you well on your care coordination journey.